There we go. Where we are also a co-convener of the Food is Medicine Massachusetts, or HIPPA Coalition, and a co-leader of HIPPA's community-based organization task force. So welcome to the first of our webinar series. These webinars came about after the CBO task force developed a set of Food is Medicine program definitions and standards. So while the definitions themselves set boundaries on what types of programs are considered food as medicine programs, the standards set benchmarks for gold standards and specific elements of program design and implementation. So recognizing that not all food as medicine service providers are currently able to reach all of those standards, members of the CBO task force are bringing their expertise or experience to provide technical assistance or education on these subjects. So today launches the first of these educational series, where we'll be starting with the world of HIPAA compliance. The goal of this session is to demystify the pathways a food as medicine organization might need to comply with HIPAA, and to hear from some food as medicine providers directly how they did it. So first, we'll hear briefly from two of our panelists in order to set the stage of different ways that CBOs have gone through the HIPAA compliance process. And from there, we'll have a presentation covering the basics of HIPAA regulations, and then move on to a panel discussion on how some CBOs have implemented procedures and technologies to comply with those regulations. So first, two of our panelists, Christine Sullivan, Program Manager at Coastline Elderly Services, and Michael Lantow, Program Director for Fresh Connect at About Fresh, will tell the tale of two CBOs, one of whom was fully embedded in HIPAA compliance from the start, and the other that had a real journey with it. So Michael and Christine, please tell us a little bit about your food as medicine programs, and what about those programs triggered learning more about HIPAA?
I'll go first if you like. So at Coastline Elderly Services, we are the Aging Services Access Point and the Area Agency on Aging, which means that we are state and federally designated to provide services to older adults and disabled adults. One of the programs we provide is home delivered meals and congregate meals. So that's where the food as medicine or the medically tailored meals come into play for us. But we also have a contingent of nurses and care managers. We do money management, home health aides, transportation, so a whole variety of services. So for us, HIPAA compliance was mandatory right from the very first day that those policies were enacted. And so the way that my organization complies is that every staff person and volunteer completes an online training course. I think it takes about 2 hours with a test and a certification at the end. But beyond that, we have a number of office procedures to secure people's information, everything from locked filing cabinets to data review to make sure that people are only accessing the information that they need to do their job. We take, privacy expectations very seriously, and we need to.
And I'm Michael Lantow. I work, like Hannah said, at About Fresh. We have operated our Fresh Truck mobile market for about 8 years. And it was really the foundation for our Fresh Connect program. So I'll talk a little bit about the journey with Fresh Connect. As an organization, though, we work to get fresh food to the households that need it the most via that Fresh Truck program. And that's our mobile market flagship program, and Fresh Connect, our produce prescription program. So in the early days of operating Fresh Truck, like I said, we've been operating it for about 8 years. We were partnering with health centers and just parking our Fresh Truck markets right in front of the health centers where patients could kind of come on and shop for produce. Our healthcare partners at that time, we were partnering with them, and they were just offering paper vouchers to folks, and we had no kind of data transmission, so we created these anonymous paper vouchers. Healthcare passed them out. They were redeemed at Fresh Truck Mobile Market. We then tallied everything up and then passed it back to healthcare. So there was no data exchange really of any kind beyond just a simple number of vouchers redeemed, but the vouchers were all anonymous. And over time, our program grew in a few ways. Just to be clear, we weren't HIPAA compliant at that point. But as we grew, our partners wanted to receive more meaningful data. And we realized that we couldn't effectively provide that data back to them without kind of additional measures in place to actually collect information on who was redeeming the program, the Fresh Connect program. So additionally, our ability to support shoppers was really limited because we didn't store any information about who was receiving vouchers, and again, how they were being redeemed, et cetera, when they were being redeemed. So our second iteration of the Fresh Connect program also wasn't, we weren't fully HIPAA compliant. Instead, we utilized, patient authorizations to release information. So that was really kind of the first time in this evolution of the Fresh Connect program that we were able to receive information from healthcare, specifically name, contact information, other questions as part of our enrollment process, and we were able to report back then on program data to those healthcare partners. That release of information, the patient authorization, was definitely a huge step forward for us, but it was still pretty clunky. It wasn't easy on the healthcare side, wasn't really easy on the shopper side. Even though we were, starting to collect more data, it just didn't really come together in a really easy way. So ultimately, we became HIPAA compliant somewhat recently, about a year and a half ago, to provide much more meaningful support to shoppers and to our partners without the added burden of that kind of administrative paperwork that we would be asking for from the patient. So now, where we currently stand, we have a fully HIPAA compliant administrative software platform. We're able to receive referrals more easily, communicate with patients more easily. All of our data is stored securely and kind of in a consolidated location. And ultimately, the final outcome, which is I think what we all kind of hope for in the space, is that HIPAA compliance really allowed us and continues to allow us to scale our program's impact much more efficiently and effectively than kind of skirting around using patient authorizations or anonymous data. So it's definitely been quite the journey. And like I said, our HIPAA compliance kind of framework started about a year and a half ago, and I'll later kind of touch on how it's continuing to evolve.
Great, thank you, Michael and Christine. So the two stories of your organizations are really helpful for providing some context on the extent or range of what HIPAA compliance can look like and how organizations really get to that point of HIPAA compliance. So using that as some context setting, we'll now hear from Sarah Downer, the clinical instructor and associate director of whole person care at the Center for Health Law and Policy Innovation of Harvard Law School. And she'll go over some of the legal basics of HIPAA compliance.
Thanks, Hannah, and thanks to everyone. And Michael and Christine have set me up absolutely beautifully because they really illustrate the spectrum of both activities and the evolution of what different community-based organizations might be doing to comply with HIPAA, to start to engage with HIPAA. So I'm just going to pop up some slides and we're going to spend some time just talking about what HIPAA actually is. And then we'll move back into Q&A mode with all of the panelists to really get down to the nitty gritty. You know, I think we're going to start with what is this whole universe we're in? And then what does it actually mean? Which Christine really did a great job of starting to illustrate that, as did Michael, right? It really means those procedures, the technical things that you're doing to support keeping the patient health information that you have really secure and safe, and managing it in compliance with what HIPAA requires. So we'll talk about all of that. So here are, does everyone see what they're supposed to see? All right, I see nods. Fantastic. So we're going to talk about HIPAA, the journey, not the destination. And I think that, you know, what you heard from Michael, right, that it really is this journey that you're on to figure out how you best share information with a healthcare partner as a community-based organization in order to best serve the patient and the client and to meet your objectives and goals. And so, you know, we need to be thinking about where you are as an organization today and the partnership that you're trying to sort of set up today, because what you do within that partnership might look very different from what you need to do a year from now, 2 years from now, 5 years from now. And your goals are going to inform sort of the way that you think about HIPAA, the framing that you put on the activities that you're doing, maybe how you structure things, and then some of the resources that you sort of plan to reserve as you move along this spectrum, so that you'll be able to really support your transition to becoming HIPAA compliant, if in fact that's what you need to be and where you need to go. So that's sort of what we're going to be chatting about today. So when we're talking about sharing information between community-based organizations and healthcare partners, there's sort of 3 buckets of things that we want to keep in mind, because they're all really important. One is HIPAA, right? What the law requires, and we're going to talk a little bit about that. But then there's this whole second bucket of your healthcare partner and what they want you to do, so what they're asking you to do, and then what they're requiring you to do in order to have a contract with them and to work with them to support the patients and clients that you want to serve. There may be daylight between those 2 things, right? It may be that HIPAA requires some things, but your healthcare partner is actually asking you to do a little bit more than HIPAA would require. It may be that your healthcare partner is requiring you to promise to do more than HIPAA would really require you to do. So that is just something to keep in mind. And then there's this whole sort of third bucket and really important category of your client and your mission, right? So community-based organizations, unless you're Coastline Elderly Services, right? Or unless you're Christine's organization, you probably haven't had to think about HIPAA before you started working with a healthcare partner, a more traditional healthcare partner. And so you really need to be thinking about, as you start to develop these new partnerships, what serves the client, what your clients expect. Or do they expect you to have all this information about their health? How do they expect you to use that information about their health, right? If you're a community-based organization that really hasn't had that information before, how are you using it? What does that plan look like? And then what serves the mission? So I think Michael brought up, right, they wanted to be able to better communicate with the clients that they were serving through their healthcare partnerships. And that was part of what sort of their HIPAA evolution journey allowed them to do more effectively. It also allowed them to sort of meet what their partners were asking of them. Their partners were asking them to collect data and be able to have access to that, right? So that will all inform sort of the way that you engage with HIPAA and the way that you think about it over time. And the HIPAA implications of your partnership might change over time. So this is exactly, Michael and About Fresh illustrate this beautifully, right? You start over on the left side of this screen where your partnership activities do not involve any exchange of PHI. So you're not even in HIPAA land. You're still working with a healthcare partner. That healthcare partnership may be very robust. You may have great relationships. You're really making a difference in the community, right? Those things aren't mutually exclusive. You're just not exchanging PHI and you don't need to worry about HIPAA. Then, right, depending on the partnership activities, depending on the protected health information that's going to be shared between the parties, and depending on the set of laws and regulations that are quite frankly evolving as we go, that may change over time. So you need to be thinking about that as an organization. If you're coming to the table today and you're saying, you know, we're going to start this small partnership with a healthcare organization. We think it's going to be a great thing for us. It's some part of our mission. But, you know, 5 years down the road, we're still going to keep this as a small part of the work that we do. And the lion's share of the work that we do is not going to be partnering with healthcare. Then maybe you sort of stay over in this sort of outside of HIPAA land, and that's what you plan to do. Whereas if you're going to plan to work more and more and more with healthcare, if you're going to plan like sort of Christine's organization to maybe bring on a nurse that visits people, or a community health worker that's going to start to go out and visit people and take some health information and do some sort of healthcare provision, then you're really going to want to be thinking about what your organization is going to be doing, and you know what kinds of resources you're going to need to think about along the way. And so there's a spectrum, right, where you don't have any PHI to you are sharing information with a patient authorization, or you have a permitted disclosure, right? Some kind of permitted disclosure, which means that you are getting patient health information, but it's authorized in some way or permitted by HIPAA in some way. And once you get that information, you don't have any obligations to treat it in a particular way. And then you have partnership activities that must comply with ongoing HIPAA obligations. And so that's what Michael and Christine are both referring to when they say, we are HIPAA compliant organizations. That means they're going to have ongoing obligations to do certain things, to set aside certain resources, to be able to comply with HIPAA and to manage information that patients will provide to you on an ongoing basis, or that community health, that covered entities, healthcare partners will provide to you on an ongoing basis. So this is your one-on-one, this HIPAA 101 resource. So anytime you have a question about HIPAA, you're going to start here as a CBO. This is a resource that we put out specifically for food banks as partnerships, as partners in health promotion, right, about navigating HIPAA, but it applies very broadly to all CBOs. So you can take a look in here, and this will cover, you know, where can you find all the laws and regulations you need? What are those permitted disclosures? What does it mean when someone asks you to become a business associate? What does it mean to try to do research and program evaluation and share data for those purposes? What does it actually mean to comply with HIPAA? What do you need to start to do? And where are some template documents that you can read, that you can take a look at? These are going to be really helpful for you as you think through what your healthcare partners might be asking you to commit to. So this is your 101. We're just going to go through things at a very high level. Start here. If you have questions, you can always email us or sort of follow up with lawyers that you get through pro bono services or sort of other things like that. And we can talk a little bit about that during the Q&A. So HIPAA, right, is this federal body of law that mandates the protection and confidential handling of protected health information, or PHI. So PHI is what we're going to use. That's people's health information. This health information is collected by covered entities and their business associates. So you have to comply with HIPAA if you're a covered entity or a business associate of a covered entity. Christine's organization, for example, because they provide nursing services and they do all these things, they are a covered entity. So they have certain things that they have to do to comply with HIPAA. And About Fresh is working right now, I believe, as a business associate of a covered entity. Michael, is that right? Right. So we have 2 organizations on the call today that have to comply with HIPAA because they are one of these 2 things. These terms are all defined by law. So we have this, you know, who needs to comply, covered entities and business associates. What information is protected under HIPAA, right? Again, that's PHI. This is individually identifiable health information that is created, collected, transmitted, or maintained by one of these 2 entities, a covered entity or a business associate. And we often hear, you know, well, what makes information identifiable? We're just going to get a name and a telephone number, so that should be fine. But that is PHI, right? Names, dates, addresses, and zip codes, all these different kinds of things. This is all PHI. So if you're receiving this type of information or expecting to receive this type of information from a healthcare party, this is PHI, and you're going to have to be thinking about what you're doing to be able to receive that information and what obligations you're going to have with it as a result. Under HIPAA, there are ways to share PHI, that healthcare partners can share PHI with you, right? One of them, Michael mentioned, you can have a patient authorization. Patients can share their information freely with you no matter what. They can walk up to you and they can tell you their whole life story, right? Anything a patient discloses to you, that is a permitted disclosure, right, from the patient. They have the right to tell you anything they want. This is when the covered entity has sort of collected this information and they're going to be the ones to share it with you. They can share it if the patient authorizes them to do so. And there are sort of specific ways patients can do this. This is one of the ways that About Fresh started to work with PHI, right? They got this patient authorization. The patients were consenting to share this information with About Fresh. About Fresh would get the information and then they would use it to help serve the patients. You can also have potentially a disclosure for treatment purposes. We'll talk a little bit about that in just a minute. Then you have this more formal business associate arrangement, right, where basically a business associate is taking on more or less all the obligations of having to comply with HIPAA through a business associate agreement, right? They're sort of signing up to take on these obligations as a way to be able to receive PHI without a patient authorization. And then you've got research and program evaluation arrangements that you can, that HIPAA talks about being able to share data through these. So let's talk a little bit about the treatment exception for the moment. So because this is a way that many CBOs may start to work with healthcare, right? So you may start to work with healthcare using a patient authorization model. There's also a treatment exception under HIPAA where a healthcare provider can share information with a community-based organization or social service organization where the disclosure is a necessary component of or may help further the individual's health or mental health care. And so that is an interesting broad exception that has a lot of gray in there about whether something is going to further a patient's healthcare or not. So there are some providers who may feel very comfortable sharing information with a CBO because it's part of that person's treatment under their sort of eyes, and they've sort of done the calculation for themselves and decided that it's okay. And there may be others that are more conservative. And HIPAA is an area of law where there is a lot of gray and there's a lot of discretion left to folks who are making these decisions. And it is an area where reasonable lawyers can reasonably disagree about the advice that they're giving to the particular client they're working with. So just because one organization has structured something a particular way, or one provider group is comfortable sharing information in a particular way, that doesn't mean that you're going to see that again and again and again across all the healthcare partners you might work with. So you just need to be aware of that as we move forward. Here's a little bit about research and data sharing, right? CBOs can collect data. If you're not a covered entity, the data you collect is not subject to HIPAA, but you always have to review other state privacy laws and IRB requirements. Healthcare provider can share de-identified data with you if there's no PHI, right? There's no issue, but if they're sharing any PHI with you for research purposes, then you're going to want to have a data use agreement or an authorization to do so. And we can go into that a little bit if people have questions. Then there's business associate. So if you are a CBO and you've been thinking about working with healthcare, you may have been presented with a business associate agreement where the healthcare partner says, okay, well, we're going to work together. We want to be able to share some information with you. Here's our business associate agreement. Business associates are responsible for complying with HIPAA requirements, and those associate agreements have to contain certain things. And really what you're taking on is most of the obligations of having to comply with HIPAA, which are significant, right? And Michael and Christine can both talk a little bit to the significance of those responsibilities. So, you know, it may be that your healthcare partner likes to sign businesses, likes all of their contracting parties to sign business associate agreements with them because that's their standard practice. And it really protects them to have their sort of parties further down the line sign up to sort of do all these things that they're supposed to do and take on liability if they don't, right? So, you know, thinking about a business associate agreement as a CBO, especially when just starting out working with healthcare, you really need to be thinking about what it is that you're signing. Any contract anyone puts in front of you, of course, you need to be reading every provision of. You need to be thinking about whether you can meet the provisions of the contract. This is particularly important in the area of business associates, because you do not want to sign up and obligate yourself to do something that you're not going to be able to do. And ultimately, you're going to be putting your organization in a position of risk, putting the healthcare organization in a position of risk, and then also not meeting obligations and expectations that your clients that may be really important for your clients. So you need to be thinking about that before you sign a business associate agreement. And you might be able to push back. Not every person that works with or organization that works with healthcare is a business associate of healthcare, right? Because a business associate is taking on certain enumerated responsibilities on behalf of a healthcare organization. And that phrase, on behalf of a healthcare organization, of a covered entity, is really important because, again, this is an area where reasonable lawyers can reasonably disagree if you're doing particular activities on behalf of your healthcare partner or not. And if you are not going to be a business associate, right? If you're not a business associate and you don't have to sign up for all the things that a business associate would, need to sign up for, it may be better for you as an organization, especially when just starting out working with healthcare and sort of not ready to bite off having to comply with HIPAA and putting all those resources into it at this time. So that's something that you need to be thinking about. The other thing is that your healthcare partner might be able to support you in being able to meet the obligations under the business associate agreement. They could share technology, they could limit liability. There are lots of things they can do. Again, you're going to go back to your HIPAA 101 resource that we mentioned at the top of this webinar, and you're going to take a look in there because we put some suggestions in there for ways that you can open conversations about negotiating those responsibilities with your healthcare partners. I'm going to stop there. There is stuff that HIPAA requires, but I think it's way easier to just talk through some of that with Michael and Christine giving us the examples. So I'll pull these slides down and we can move into our conversation.
Thank you, Sarah. So that presentation was really, really helpful for clarifying some of the what of HIPAA. But now I think what will be really helpful for the audience and for food as medicine providers is the how of HIPAA, of how all this actually gets implemented. So we're, as Sarah said, I think we'll be moving on to our panel discussion to learn about a little bit more about Fresh and Coastline Elderly Services and how they made HIPAA compliance work for their organizations. So I'll welcome back Michael and Christine, and I'll also introduce Matt Haffenrefer from Process First, who consulted with About Fresh in their HIPAA implementation. So actually, I'll put the first question to Sarah as one of the questions from the Q&A, just a clarifying question about something in your slides. Can the treatment exception cover long-term partnerships, or is it more generally accepted to address emergencies or one-off referrals?
Yeah, so this is really interesting. When we use the term treatment exception, the term is not exception is not used because it's exceptional, like under exceptional circumstances, right? It is the term treatment exception because you are able to share information with a social service organization because it's to further their treatment. So it's an exception from HIPAA, right? HIPAA applying to that. The thing about the treatment exception, there is actually a proposed rule from the Department of Health and Human Services that really does contemplate making the treatment exception the primary pathway that you might be able to share information with community-based organizations. So, they're thinking about, okay, is this something that could cover that long-term partnership that you are thinking about, right? Where you're like, everything is to further, when I send my patient information to About Fresh, it's definitely to further their treatment, right? They've been identified as having prediabetes, and About Fresh will give them this wonderful voucher that will help them to change their diet. So therefore, it's part of their treatment. so we can always share PHI with about fresh under a treatment exception. This, like that scenario will make everyone a little bit nervous, right? Because what you're going to have is information flowing out the door to whoever providers decide will help them to treat their patients. And we are in this period of huge evolution about the way that we think of healthcare and the way that we think of health related social needs and social determinants and who should be in this sort of healthcare circle, and who we need to be talking to really address the real extra clinical needs of the patient and what is treatment and what isn't. So I would say that's a very gray area. And I would not say on this webinar that you can cover a long-term, regular relationship of sharing information back and forth through a treatment exception, but I also wouldn't say the law prohibits you from doing that at this time. And I would say HHS is thinking about that treatment exception as a way that we might be able to more easily share data that would help healthcare organizations best meet their patients' needs. So that's what I can give you right now. I know that's probably unsatisfying, but that's where we are.
Thanks, Sarah. All right, so the first question is for Michael. So can you talk us through a little bit more about your evolving relationship with HIPAA and how it has impacted your programming?
Yeah, so, like I mentioned in kind of the introduction, HIPAA became kind of an increasingly important consideration for us as an organization in order to, most effectively carry out our program. So some of the, some of the program changes that happened, in addition to just being able to receive name, was again really focused on that relationship side of the program, which is so important to us. And we want, we wanted to kind of from the early days maintain that level of trust and partnership with our shoppers that shop at Fresh Truck, and then subsequently patients that are referred through healthcare through our Fresh Connect program. So, anchoring our program in those relationships and in that trust was really foundational. And that's one of the reasons that HIPAA really became kind of a growing priority for us. Also, just thinking kind of the next step of how HIPAA, now that we've kind of implemented it beyond relationships, beyond data, we are able to provide our services to healthcare with much more rigor and intent than I think was previously possible. Given that we can kind of freely transmit information, but we'll get to some of the limitations actually on that. But we're collecting information that is important for healthcare that we can kind of maintain in addition to what they have, and communicating about that is much easier than it ever has before. So again, as far as how it's directly impacted our program, it's really, the trust goes in all directions, not only with our shoppers and enrolled patients, but also with our healthcare partners, current as well as prospective as well.
Thanks. So more on that, Michael, can you provide some examples of what practices you have in place in order to maintain the privacy and security of the health information you receive from clients or referrals? And in particular, if you can also speak to what software you use, patient software.
Yeah, sure. So, in becoming HIPAA compliant, part of the way that we were maintaining privacy and security of that information is first just kind of outlining a variety of policies and procedures that, are largely kind of our HIPAA governance documents. They tell us and other organizations kind of upon request, how we're maintaining privacy, especially in the event of an emergency. So there's kind of that foundation already set, but really as far as like tangible safeguards. We early on, we got a dedicated laptop that, as an organization, we all tend to use our personal computers, but we got a specific laptop that's an About Fresh laptop for kind of sensitive information use. We have a variety of well, when we were in the office, a lot of like locking cabinets and places that we could safely store materials that may have sensitive information. On the technical side, we did a variety of different technical safeguards about who can access information in our software, how those accounts are created, how they're maintained. So to the second part of the question, we, in partnership with Process First, we built our own software platform. So it's not actually built on like Salesforce or something like that. So for us and for Process First, by extension, there were a lot of procedures that had to kind of get up and running on the software side, on the back end, to ensure the integrity of the data. The last thing I just wanted to mention here is one other kind of safeguard that I think we don't talk about it a whole lot, but it's actually really important, is ensuring that we're looking at patient information really just when it's in kind of the normal course of business, and we're not just checking in on people's information just for fun. There has to be really kind of an intent and a purpose, especially as we grow. That'll be increasingly important.
Matt, can you say a little bit more about how Process First worked with About Fresh to develop the software, and what were some of the considerations of procedures that you had to integrate into developing the software?
Sure. So I think there's two parts to that. One is about how we built the software and where we incorporated considerations for the HIPAA side of things. But a lot of the work that's relevant to this conversation is more about the things that are happening both within the software and the way we approach it that allow it to be HIPAA compliant. Then there's things like where certain passwords and keys are stored, and how, a bunch of things that don't really matter up front. They're just kind of things you have to do to best practice or beyond, that are really important to making sure this thing is secure. And at the end of the day, that the way information is stored can't be broken. And if there are issues that we log information, we report it, we hit certain timelines, and those meet some best practice. But a lot of those are partner specific from our experience thus far, where the partner requirement is more specific than the general requirements of HIPAA. So we design it to that spec, or to one that we decide is a bar we want to uphold, that maybe allows us to get to other partners with different requirements. Then from a software development point of view, in terms of building the platform, I think HIPAA is sort of this foundation that you have to think through, or not even a foundation, like a filter through which you have to think. We want to do this normal interface that has normally certain user requirements, and to make sure that as we're doing that, it aligns with the way healthcare wants information to be managed in accordance with HIPAA, or in best practice for the way we manage patient data that also delivers a really great experience. And it kind of opens up from there. So maybe if there's other specific questions, I can go thereafter.
Yeah, thanks, Matt. So turning over to Christine, similar question to Matt. So can you give some examples of what practices Coastline Elderly Services has put in place in order to maintain client privacy and security of their health information? And I know that Coastline has had a lot of these processes done from the start, but maybe if you can highlight some of the ones that have had to change over the years.
Sure. So I would say, like, from a very small thing, which as a user, it can be a little annoying, is that our laptops are all set to log us out after 5 minutes of inactivity. So if you get up to go make a cup of coffee and you come back, your screen will be blank. But that's just a very small way that privacy can be protected. More recently, we had an office change where we used to have the paper shredder and then the paper recycling bin. And I think there was maybe a gray line between what was supposed to be recycled and what got shredded. So now everything gets shredded. So just like it's a really small thing, but it's just procedures in the office that you tend to notice that are getting stronger, I suppose, over time. You know, we keep trying to adapt as we're able to strengthen our privacy and security standards. We do have a chief information security officer, right, who is responsible for maintaining the privacy, letting us know about phishing emails, which every now and then grabs somebody, no matter how hard you try not to click the link, somebody sometimes does. And you know what that does right away to change things in the organization. We have small meeting rooms. We recently moved into a new building, and that was one of the features we were able to add, so that when clients come to us, we have nice little rooms where you can meet privately and not be standing in a more public space trying to talk to people. Going back to the compliance officer, they run, I guess, a random 10% data search every year, just to sort of make sure people are only accessing the information they need, which kind of speaks to Michael's point about not looking up people for fun or just being nosy about their health status. I would say COVID changed things a bit for us because we went from everybody being in the office to nobody being in the office, and how to get laptops online really quickly to the people who didn't already have them. People were using personal computers, personal phones, personal email accounts, and, you know, trying to jump in and fix that as fast as possible. We weren't really prepared for that. So I think going forward, we probably will be in a better situation.
And Christine,
Can I lift up just two things that I heard that I thought we might want to emphasize from all the comments so far, which is one, sort of Matt's comment about, you know, they build the technology capacities to best practice, right? And to sort of the bare minimum of what's required, but then beyond that, if the partner is asking for more, right? And that is something that we frequently see in this space, is healthcare partners that are asking for things that, you know, are above and beyond what that sort of what HIPAA would require. And so here, right, between these two things, there's a lot of room for negotiation about what you do, what it looks like today, and what it looks like, you know, next year during that partnership. And, you know, so we want to be empowered as community-based organizations from that perspective to ask for what it is that you really need, and be honest and transparent about what you can really do as you're sort of developing the capacity to work with healthcare. Because you don't want to be in a scenario where you're sort of over-promising and under-delivering, because that's where things get squeezed through the cracks, get lost, the breaches happen, right? And then from Christine's perspective, like, they've been really a covered entity since day one. And I think what her comments really underscore is that you are continually thinking about how you become better at protecting your patient information, about sort of meeting the expectations of your clients, and thinking about, you know, what is going to really make them comfortable, having those sort of smaller rooms where they can be, you know, so that people can't overhear them, or maybe even see that they're visiting, right? Like in the organization. So, and changing policies from shredding some things and recycling other things to shredding everything. Like, there's all these things, right, that you're going to have this privacy officer in your organization that is going to continually revisit what's required, what are the best practices, how can we continue to sort of evolve this so that we're really making sure that we're handling this in the best way possible. So it's not we're HIPAA compliant, we get the stamp and like it's all done. It really is sort of an ongoing investment. And so I think we just want to raise those things here, because we want to be mindful of where a lot of organizations might be going, especially if they continue to work with healthcare over time. Like, they're going to be in pristine land, they're going to be in sort of about fresh land, right? They're going to be really thinking about this a lot. but they might not have to start at that place of being able to comply with everything their healthcare provider is asking of them in that initial contract. So let's just, be mindful of that as we go forward.
Yeah, thanks, Sarah. I think, that sort of leads into, the point of it being a little bit of a negotiation leads into the next question of, what are some of the challenges that you faced in developing these practices? And can you say a little bit more about the extra burden, whether that's time or money, of becoming HIPAA compliant or meeting the requirements of a partner? I'll pass that question to Michael.
Yeah, there were lots of challenges. The initial one was really kind of in the early days of one of our primary healthcare partnerships. We weren't expecting to go through this super thorough technology review to ensure that our platform and by extension kind of our program and organization was really kind of up to their par. So, like Matt was talking about earlier, there are some kind of foundational things that we can do. And then on top of that, there might be things that organizations or healthcare partners might ask of us. And we were pleasantly surprised to find that there was a lot that our healthcare partner was looking for. Ultimately, while it was unexpected and it did, it took a lot of time, it took about 3 months or so to kind of fully implement everything. It was really important for us. Again, coming back to the importance of HIPAA as a practice, but also, not only for that reason, it helped kind of solidify a lot of the underlying systems in our technology. So, that process, while at the time, again, was tedious, ultimately it really kind of advanced our program. Some of the other challenges beyond just time, there was a cost associated with that. We also had to work with legal partners to draft those policies and procedures I was mentioning earlier. Very helpful. Again, just, some of the challenges that we had to work with. Those were really the primary challenges that we faced.
Christine, can you speak to that as well?
For us, or for the part of the program I work in, because Coastline is big and I don't touch everything, I would say the burden we've felt most recently has been onboarding volunteers. So we have, maybe 200 volunteers at a time, and there's some turnover there or ramping up for one program or another. And just going through the training process on HIPAA, we do the Corey background check as well. So it's just sort of an extra layer of administrative burden when it comes time, when people want to come on, and figuring out the value on that and when it's worth it and when it's not. So for us, HIPAA is so embedded in the organization. It's simply something that we all, you get the email once a year, time to renew, you jump on, you do it. So it's a burden for our compliance officer, no doubt, to maintain all that documentation. But I think for the employees, it's not terrible.
Matt, can you speak to the challenges that you faced or About Fresh has faced regarding protecting client privacy itself?
So framing that question just slightly differently. Security, there's sort of two aspects. I think there's security, which is how you ensure things don't go wrong. And you could spend all the time and money in the world in a team of 100 and never be perfect, because there's no like hard rules. It's more about how do you make sure that the way you manage information, passwords, access, credentials, are all done in a way that's careful and managed and understood, and you're aware of where your risks and your liabilities are. And so I think it's really important as you enter this process is to realize that it's really a prioritization. There's a dozen different things you have to be aware of. You have to do all of them to certain degrees. Some are more important or less depending on how you're building your system. And then you manage those things. So it's sort of a commitment to uphold an approach to work that says, hey, we're not just going to give out access to this part of the software to everyone because people don't need that. So you restrict that. And so one way that I think has been helpful to think about it is beyond just HIPAA, how do you just make sure that you feel secure about the way you're building and create a program and have access to it, and the specifics of the specific boxes you're trying to check are just ways to evaluate your progress towards that goal. And then on the other side about managing data, I think that sort of follows that. It's really just about not creating access where it's not needed. Like, for example, I don't write code, so I don't even have access to any of that information. There's no data I have that would ever put me at risk of having it, or a patient's information of being in my hands, because I don't need to have it. And so to that end, I think what we're just prepared for is you set up so that if something were to go wrong, you would find out and you can alert your partners. And that's really about the procedure. The tools have been built, so there's process in place so that should something happen, because there's no perfect system, you're prepared to alert appropriately for your partners, and then you can work on that process. And Michael, does that sort of cover, I think, the right level of what that relationship looks like between us?
Yeah, I think that's fine. Thanks.
So Michael, can you tell us more about some of the benefits you've seen through developing all of these practices?
Yeah, for sure. As I kind of mentioned in the introduction, the benefits on on the relationship side, on the communication side, is really apparent. Our program, I think, is much stronger overall because of those relationships and that shared trust that we have, again, with our enrolled patients, shoppers, and healthcare partners. Beyond that, we also have greater flexibility in what types of data we collect, how we interact with it, what information we provide back to healthcare. It's a little bit easier to navigate some of those conversations as well. So we weren't necessarily intentionally avoiding HIPAA in those early days when I was mentioning kind of the evolution of our program. And we were just kind of operating the program. Once we kind of saw that becoming HIPAA compliant would improve our program, we very intentionally pursued it, because we definitely saw that the benefits of becoming HIPAA compliant outweighed the kind of short-term burden of costs and time and those other things that I was mentioning previously.
Great. So I want to close with a question about suggestions on where our audience should begin after this meeting. So, well, first for Sarah, there's just another, I think, clarifying question about the treatment exception. So maybe for people who are still thinking about that, the question is, could we safely say that programs where the referral is only a food insecurity screening, not any clinical data or markers, that doesn't count as treatment?
Oh, I'm going to give a lawyerly answer of it depends. So I think the question is, so if all you're doing is doing a food insecurity screening, and then you want to refer everyone who screens as food insecure to some organization for their services, could you disclose the PHI under the treatment exception? Would that be considered treatment? And I think, what the example that we see in the literature around this, meaning that this is the example that HHS has given, about disclosure to a social service organization is when someone, for example, might need specific mental health issues, need supportive housing, that the provider can sort of tell the CBO that's going to arrange those services what the patient needs, can disclose that amount of PHI. So what that says to me, and that's the only example they give. So what that says to me is that we're thinking about something on an individual level, not sort of a group level, right? So we're saying probably not everyone that's food insecure and gets that referral might be, that could be covered under the treatment exception. But let's say someone has diabetes and they screen as food insecure. Could you do that for everyone with diabetes, given where the literature is on the link between diabetes, food insecurity, hypoglycemia, et cetera, like all of that sort of literature? You could definitely make the argument that the food insecurity referral for someone who has diabetes is part of their treatment, right? Like I could make that argument. Would I make that argument as part of the healthcare provider? I don't know if I would rest on that argument, but I could definitely make that argument and feel okay about it. So I think this is another example of that treatment exception being kind of a hard area to sort of build your whole partnership on. And I don't think your healthcare partners are going to feel comfortable doing that over the long term, generally speaking, if you're sort of contemplating a larger partnership.
Thanks, Sarah. So we are at time for the webinar, but I did want to note just again about the suggestions for where to begin after this. So there are a few spots. One, if you're not sure if you need to be compliant or not, we really suggest that you check out the HIPAA and food bags resource that we put in the chat, and we'll also make sure to follow up through email with that resource. And if you do need to be HIPAA compliant and you're wanting to learn more about how to do that, the best piece of advice we have is to find legal counsel for your organization. I know that's a little bit of a not helpful today answer, but that is usually what your best course of action is going to be. But since we're at time, I just want to make sure to thank Sarah, Michael, Christine, and Nat for providing all of this context and understanding, and also just the practical responses to what HIPAA compliance means. And we hope that you all found this useful as you begin or dive deeper into the world of HIPAA. But with that, hope everyone has an excellent day, and we'll send the resources soon. Thanks, everyone.